Nearly 14 million American children and teens are considered obese, raising their risk for heart disease. The American Academy of Pediatrics released new ways to treat childhood obesity. And with us today to talk more about that is Dr. Metz, a surgeon from Denver Center for Bariatric Surgery. Thank you so much for being with us, doctor.
Thank you for having me.
We appreciate it so much. We know for young people struggling with their weight, what should they focus on at first as they try to shed some of those pounds and get healthier?
Well, we've been working with many pediatricians for years trying to focus on healthy living and increased physical activity, but we're really just not reaching some of the kids that are really struggling.
And when you talk about really struggling and you talk about obesity, what does that look like? I mean, and is in excess of their body weight?
So there are a number of different statistics that we use to try to gauge whether a child is obese or morbidly obese, and those statistics are a little bit hard to swallow. So we like to use something called the body mass index, which is a height-weight ratio. And the body mass index isn't perfect, but it's the best tool that we have right now. Basically, if a child has a body mass index over 35, or especially if they have a body mass index over 40, they meet criteria for intervention and not just with diet and exercise anymore.
What do you see as the mental state? You know, because it's like if you can't get outside and enjoy it and do the things that kids want to do, ride your bike, hike, play, right? It certainly must take a toll on children's mental capacity.
Absolutely, and one of the things that's critical in taking care of kiddos and adults as well is employing a mental health component to our programs. So weight loss by itself, just diet and exercise, we've seen does not work in a vacuum. And once a child hits a body mass index of 40 or 35 in some kids, they only have a 1% chance of getting the weight off long term without surgery, which is really a scary statistic.
And so now more surgeries for children that are obese, correct?
Yes, and we're not trying to push surgery as the first line of defense. And this is an adjunct. We're trying to incorporate this as one potential tool for kids. So we use diet, exercise, mental health, all different types of counseling. There are new medications that are now approved for use in adolescents with long-term data out there. And surgery is just another tool in our armamentarium to try to help these kiddos.
So as after they go through this process, they still have the help and people to walk with them and to go with them and to help them as they come out of this too, correct?
Very much so. So this, as part of being a center of excellence, we have to have long-term contact with our patients, and that includes support group, mental health, long-term follow-up from a dietitian perspective, and seeing ugly people like me.
Well, let's real quickly too, let's talk about it. If there's a parent out there or even a young person thinking for themselves and they have a conversation with their parents and they know that they're getting to that critical point, right? What would you say to them when they're not there yet? They haven't tapped over into the obesity numbers, the BMI index, but they're close. What would you say to them?
It's a very challenging situation. I think for parents in particular, trying to put that on their pediatrician when a pediatrician sometimes has 7 minutes to have a consultation with a kid, being able to broach that in a sensitive and caring environment is very challenging. I think that using a lot of different techniques from a leading by example perspective is a great place to start. It's hard to have a conversation with a child about eating habits when the parent themselves might not be having the best eating habits. So making it a we problem instead of a you problem is the first place to start.
Yeah, we all need a support team, don't we?
Absolutely.
For sure. Thank you so much for being with us, doctor. We appreciate your time and your insight for all that's going on out there. Remember, you can watch all of our health interviews right now on CBSColorado.com.